Chapter 11. Motivation. If a pretty poster and a cute saying are all it takes to motivate you, you probably have a very easy job. The kind robots will be doing soon. Today's schedule. Basic motivational concepts: hunger, sexuality, affiliation, achievement, instincts, and evolutionary theory. Instincts are fixed behavioral patterns that are not learned. Human infants can root and suck. Instinct theory viewed instincts as the source of motivations. While genes predispose some behaviors and instincts, this cannot explain all human motives, drives, and incentives. Drive reduction theory: we are psychologically driven to reduce physiological needs. Drive reduction helps us to achieve homeostasis. We are also pulled by incentives. Rewards increase dopamine levels and cause drives to become impulses. Punishments serve an incentive for behavioral change. Arousal theory. When basic needs are met, creatures tend to explore for the sake of curiosity. Yerkes-Dodson law states that moderate arousal leads to optimal performance. When we are bored, we seek stimulation. When we are overwhelmed, we want to reduce stimulation. People who enjoy high arousal are sensation seekers or risk takers. Might be more motivated to master emotions and actions. Hierarchy of needs. Maslow argued that some needs take priority, added self-transcendence near the end of his own life. Meaning is perceived when people are aware of the significance of their life's purpose. Predicts overall well-being. Order of hierarchy is not always fixed and varies across cultures. Physiology of hunger. When people are consistently hungry, they lose interest in other things. Stomach contractions are what make us feel hungry. Is not the full story, since hunger persists even after stomach removal. Body chemistry in the brain. The hypothalamus controls feelings of hunger along with other motivations. The arcuate nucleus makes us feel hungry. The ventromedial nuclei makes us feel full. Ghrelin, hormone secreted by empty stomach, makes us feel hungry. Orexin, hunger-triggering hormone secreted by hypothalamus. Leptin, protein hormone secreted by fat cells, decreases hunger when abundant. Peptide YY, digestive tract hormone that signals we are full. Taste preferences. Salty and sweet are universal preferences. Some preferences, aversions, are conditioned. Culture affects taste preferences. We avoid unfamiliar foods but can start to like them if we sample them. Some spices inhibit bacteria growth. Pregnancy-related nausea and food aversions protect the baby from toxins. Tips for weight management. Need to be motivated and disciplined to change eating habits. Exercise and get enough sleep. Minimize exposure to temptations. Limit variety and eat healthy. Reduce portion sizes. Time meals. Prevent binges but accept they happen. Plan before eating with others. Track progress in an app social group. Biopsychosocial influences on sexual motivation. Sexual risk-taking and teen pregnancy. Contributing factors. Lack of communication about birth control. Factors that delay sex. High intelligence and focus on future achievements. Impulsivity and religious engagement. Alcohol use and close family attachments. Popular media provides social scripts for sexual behaviors involved in community service. Sexual orientation. How our sexual motivations are directed varies across cultures, but is likely because of discriminatory laws. Conversion therapy does not work. LGBTQIA+ folks are at greater risk of suicide and mental health issues. Even animals display varying orientations. Origins of sexual orientation. Differences in hypothalamic structure function. Differences in spatial abilities. 1/3 of variation can be attributed to genetics, and many genes are involved. Fertile females theory implicates maternal genes. Altered prenatal hormone exposure. Older brother effect and maternal immune response. Benefits of belonging. Having a social identity boosts our well-being. Cooperating in groups enhances survival. Affiliation need is universal. Self-determinism theory says we need to satisfy three needs: competence, autonomy, relatedness. We conform to group standards to be accepted. Feelings of love reduce pain. Social isolation affects mental and physical health. The pain of rejection. Ostracism is social exclusion and influences behavior. Can motivate us to seek out others, eat unhealthy foods, or be more involved in religion. Can make people disagreeable, uncooperative, and hostile. Our worst memories are often about rejection. Activates the anterior cingulate cortex, same area active when in physical pain. Rejection hurts more in individualistic cultures. Online social networking. Effects. Small positive correlation between teens' social media time and risk for anxiety, depression. Usage may predict future mental health. Mixed results on whether restricting use reduces concerns. Easier to disclose more online and strengthens friendships. May support narcissistic tendencies. How to limit negative effects. Track social media time. Monitor your feelings during and after use. Limit interactions with friends who overuse it. Do not check it when studying. Take a walk if you notice you are doom scrolling. Achievement. Motivation. Desire for significant accomplishment, mastering a craft, control, and attaining a high standard. Most successful people are ambitious, energetic, and persistent, have grit. Tend to have more hobbies, motivated through all phases of projects. Discipline matters more than IQ. Natural talent is also a factor in success. Intrinsic versus extrinsic motivation. People who value intrinsic rewards also receive more extrinsic rewards. More likely to earn an advanced degree. Extrinsic rewards work better for menial tasks. Should not be used as a bribe. Should be used sparingly. Goal setting. 1. Make a SMART goal. 2. Announce the goal to others. 3. Develop a detailed implementation plan. 4. Reward short-term achievements. 5. Monitor and track progress. 6. Create a supportive environment. 7. Make the behavior a habit. To-do list. Chapter 11. Practice quiz attempts. Read, review Chapter 12.